Now let's talk about gallbladder 35, another C-cleft point. This is located 7 proximal to the highest prominence of the lateral malleolus on the posterior border of the fibula, needling vertically 0.5 to 1.5 tun. How to find GB35? Using the quick method, spreading hands technique, locate GB35 at the midpoint of a line connecting GB34, which is in the depression anterior and inferior to the head of the fibula and the highest prominence of the lateral malleolus on the posterior border of the fibula, distance of 14 tun. GB35 is located 7 tun proximal to the prominence of the lateral malleolus, or using the spreading hands technique, locate GB35 1 tun distal to the midpoint of a line connecting the popliteal crease and the highest prominence of the lateral malleolus on the posterior border of the fibula, distance of 16 tun. For orientation, the borders of the fibula are deep to the peroneus brevis muscle and are often not easily palpable. For this reason, it is suggested to palpate the posterior border of the fibula just superior to the lateral malleolus and then locate the point on an imaginary line running to the head of the fibula. Located on the same level are GB36 on the anterior border of the fibula and bladder 58, 7 tun proximal to bladder 60. Special features, C-cleft point of the Yang Mai, meeting point with the Yang Mai, according to some authors. GB35, the cleft point of the Yang vessel, is often used to clarify consciousness in cases where yang circulation is failing to reach the head. Consequently, traditional indications for this point often include mania and withdrawal. As might be expected, the point also benefits chi circulation in the liver and gallbladder, and is thus often seen in cases of hypochondriac or chest pain. GB35 is mainly used for acute pain along the gallbladder meridian with stiffness and cramp of the leg muscles. It coalesces with the Yang Mai, thus reinforcing the gallbladder meridian influence over the lateral costal areas and neck. The role of the Yang Mai in regulating the yang supports the gallbladder's ability to calm liver yang rising. Emotional lability, tinnitus, deafness, and confusion, and balance, stagnation, or deficiency, both of gallbladder and liver. Fright, distension, and pain in the chest, asthma, feeling of obstruction in the throat. Gallbladder fright can affect the heart protector, which is the pericardium, and heart, as the gallbladder divergent meridian passes through the chest and connects with PC1. This can lead to anxiety or palpitations, or if heat is also involved, to Shen disturbance and manic behavior. GB35 is crossing point of gallbladder, stomach bladder, and Yang Mai, or the linking vessel. This is the accumulation point of Yang Mai. It is a special point for neuralgia or pain following the GB meridian, especially neuralgia or paralysis of the tibial area. Relaxes the sinews, especially around the knee and lower leg. Helps with clarity of vision where the patient is confused or muddled in their mind.